Good evening. Welcome to Branco Broadcast. I am Bob Branco. I'm very pleased to introduce this evening Lisa Salenger. She will give a brief background of what she would like to talk about and then take questions from you. Welcome, Lisa. It's a pleasure.
Thank you, Bob. It's my pleasure to be here this evening. I find that in my life I wear several hats, and those kind of have converged tonight and are some of the reasons that I'm here. Let me tell you briefly a little bit about myself. I worked for the state of Pennsylvania for 12 years as a rehabilitation teacher. I worked with people who are blind or visually impaired who had lost some of their sight, and my job was to work with them so that they could live independently. Also, as part of my job at that time, I did conduct some in-services, primarily nursing homes, not so much hospitals, but I did some with nursing homes. Currently, although this is not quite so related, I work with a company called Mystic Access, which produces technology tutorials. And the other work I do is with a company called Blind Alive. And I know that Mel Scott was a guest with you a few months back. And we produce described workouts. And we also blog on various health-related topics, and we podcast on those as well. The final hat that I wear that I'm talking about tonight is I am on the board of the Pennsylvania Council of the Blind. And as such, I serve on the Information Access Committee. And I was not directly involved with the formation of the document I'm going to talk to you about tonight, because that was done before I became involved with the committee, although I did help with some of the final draft processes. So it is primarily in that capacity that I'm speaking to you tonight. And, you know, a lot of people, the document is about best practices that hospital and medical personnel can use when dealing with people who are blind. And people say, well, you know, I'm in pretty good health. And this really doesn't relate to me. And I would submit that that is not necessarily the case, because all of us, at least we should, have regular medical checkups. And so we may find that it's helpful to disseminate this information. I mean, how many of us have been propelled by the arm, or how many of us, if we have to give a urine sample, have had staff who think that they ought to be in the bathroom with us? I actually dealt with this rather unkindly when I was about 6. And I like to think that I've improved. I was in a Catholic hospital having my left eye removed at the ripe old age of 6, and this nurse identified herself to me, and she was a nun, and she showed me where the bathroom was, and, you know, 6-year-olds can't hold it that long. And she's telling me where everything is. And finally, in desperation, I said, okay, sister, you better get out of here now, because it's going to stink real bad. And so I like to think that my advocacy skills have improved a little bit since then. So we have situations where we are patients. Some of us are patients more frequently. Some of us are hardly ever patients. Something that happened to me recently, and if you've read anything I've written for Blind Alive in the last few months, I've blogged about this. I woke up on April 7th to hear my friend who lives upstairs in the house that we shared calling out to me. And I went up, and to make a long story short, she had a very severe stroke. A stroke so severe that she will, barring a miracle, never come home. She is in a nursing facility, and they have to use a lift to get her in and out of bed. and in and out of the chair and all of that. So it was a very bad one. And overnight, I had to become her advocate. I am essentially the only family that she has. And so I learned in a hurry how to interact with hospital staff and get what she needed. And I feel like there are so many things I could add to this document now, but there are lots of resources. I believe that Deborah Kendrick spoke to this group last week, or at least I heard that there was going to be a discussion of whatever topic, and I thought, oh, I bet that was Deborah Kendrick. So I'm assuming perhaps that she or someone else spoke about their hospital experiences. And I think that there are some differences and some similarities when you are in the hospital as a patient and when you are in the hospital as a family member or an advocate for that patient. And so, I have had lots of experiences, and it's one of those things where when I read this document, I thought, wow, this is good, this is important. But then when I really needed it, I found it was very helpful to actually print out copies. Right now, you can go to the website. There are two ways that you can get the document. You can contact the Pennsylvania Council of the Blind, or you can, and the best way to do that is through the website. You can also go onto the website and just put best practices into the search, and you will find the post that has the best practices document. Right now, we do not have it in downloadable printable form. If you are tech savvy, you can just copy and paste it into Notepad or Word or whatever you want and print it out. Or if you want a pre-printed form, there's a contact us section on the website, and you can contact the office of the Pennsylvania Council of the Blind, and they can send you a copy of the document. The document itself is called Best Practices for Healthcare Professionals with Patients Who Are Visually Impaired. And I'll read just a little bit of it so that you get a general idea. It's a relatively long, fairly meaty document, I think. Introduce yourself and address the patient by name so he knows you are talking to him and not someone else. Introduce the patient to any roommates or accompanying staff. Speak directly to the patient whenever possible. Do not ask a third party about the patient's likes, feelings, needs, etc. That sort of amuses me, especially when there's someone who's not comfortable with patients. Because now my friend and I really make them nervous because they don't really want to ask her because she's the patient and it might be catching. And they don't really want to ask me because I'm blind and that might be catching too. So it's kind of funny. They sort of have to just get through that. Here are some others. Ask the patient what she can see. Few patients are totally blind. Ask the patient what assistance is needed instead of assuming what he needs. If the patient is a child, be sure to discuss any special needs with the parent. It may be less frightening and disorienting if a parent spends the first overnight with the child. This might also be true if a relative has dementia or related memory loss, etc. Let's see. Some of this is so obvious to us, but it's not necessarily obvious. I'm skipping some, but here's one. And I thought, there's a sentence about that hearing is not necessarily affected. But this one sentence says, show respect by speaking at a normal volume and tone. And I thought, that's really true because it's not just common sense, it's respectful. Conduct conversations like you would with any other person. Speak to the patient anytime you enter the room and explain when you entered or why you entered. For example, dropping off some supplies, turning out your light, refilling your water, etc. I had a good one time. I was in the hospital for a surgery, and I have no sense of smell. And it was soon after surgery, and so I was sleeping quite a lot. And a friend of mine also who came in was totally blind also. And unlike me, she had a really good sense of smell. And she said, "What is that awful smell?" And I obviously said, "I don't know. What do you mean?" And she said, "I don't know, but I'm worried if it's you, because if it's you, you need to be seen. Someone needs to check it out." So she's going around my room and sniffing. She determined it wasn't me, and she's like, "Is it an animal? What's going on?" She said, "It's really bad." And finally, she found it. Someone had brought my tray, didn't tell me. I guess that was around 5 o'clock. This was around 8:30, and she found it, and the culprit apparently was meatloaf. So the lesson for medical people is let the blind person know when you're bringing in a tray. I'm afraid the message for patients may be avoid the meatloaf. So, lots to learn, lots to discuss in this document, and it really can be used as a tool. We have found pretty good success in offering printouts so that it can be hung on a bulletin board, or sending it by email so that it can be disseminated to staff. But I really think, and this is kind of veering into personal territory, but I really think that a lot of this comes down to a couple things. And one is being comfortable with your own blindness. When my friend entered the hospital, I had to let staff know that I couldn't see. Only because I didn't want them thinking something was odd because I wasn't making eye contact. And I was saying multiple times a day, I'm blind. And it was a little uncomfortable even to me because I wasn't used to saying it that much. But if someone is uncomfortable with their blindness, which I don't feel that I am, it would be even worse. The other thing is, I think it's easy for us as blind people for us to kind of have this conditioned response. We're used to people doing things for us, bringing us food, getting us things, helping, making the path easier. And that's fine. Each person has different levels of that. But especially if we are in there as a caregiver role, we need to remember it's really not about us. One of the nurses told me that there was a blind person who came in and visited their family member, and they were only in like twice a week. But when they were there, they expected the staff to walk them wherever they needed to go and to get a tray of food for them from the cafeteria, things like that. And I just feel like that's not acceptable, because anytime that a medical person is doing for me, then they're not doing for my friend, or they're not doing for somebody else who really needs it. I did find out there's a room that has, in the nursing home where she is now, it's like a pantry room, and there's an ice machine and a refrigerator. And so I bring her things that she enjoys. Another thing I learned, this is kind of a stupid little insider trick, but if you're bringing food for somebody and you need to put it in the fridge, don't put it front and center. You want to find the most obscure place. Put it in one of the drawers where produce goes, because people generally don't store stuff in there. And if you store it in out-of-the-way places, it's less likely that it will be moved, and then you can easily find it again. There's a microwave. one of the nurses said, "How do you use that microwave? It's all flat." And I said, "You're not going to like my answer." I said, "I just press buttons until something happened." And fortunately, there's a button in the lower right-hand corner of this one that's like every 30, like it'll go for 30 seconds or 20 seconds or whatever. And so that works. But I think anything that you can do to advocate for that person, and it really is a full-time job, and it means sometimes asking, really it's a lot of humble pie. It's a lot of saying, "I'm blind." It's a lot of saying, "What is your name? What is your title? What's written on the board?" When they bring my friend's dinner tray in, I'm there every day from about 4 to 8. When they bring her tray in, I always ask what's for dinner, because that way I'll know if there are things that I need to help her with. Or I'll ask her, "Did you eat this?" or "Did you eat that?" Or I might say, "Did you eat your pie?" And she'll say, "There's no pie." And I'll say, "Yes, there is. They said there was pie." Because she's not seeing, as a result of the stroke, she's not seeing things on the left. And so I'll go over and I'll feel for a plate on the left side of her tray, and I'll either point and like have her follow my hand to it, or if she's really tired and just done for the day, I will move it over to her right so she can see it. So it really means asking a lot of questions. Another thing I'm going to do, and I know that this is more long-term care, but you can do this even if you're in a hospital, either as a patient or as an advocate, even if you're there just briefly, and you find that your experience was less than perfect, you can contact, well, pretty much anybody there will tell you who to contact, but you can offer to do an in-service for staff about blindness, because chances are you're not going to be the only one, and it would be a good staff enrichment activity. Often places need to provide so many hours of staff training, and so they're interested in stuff like that. And one thing you can encourage them to do, and I used to do this when I did my in-services for the state, was encourage them, not that I love being videoed, but encourage them to video it, because then they can share it with different staff on different shifts, and also with new people who are hired. So anyway, I think I have probably gone on quite at length. I hope I have answered the kinds of questions you have, but if I have not, I will be happy to explain or clarify anything that I can.
Thank you, Lisa.
I have a question.
Jay?
Yes. Thank you, Bob. Lisa, you mentioned that you keep explaining yourself and telling them that you are blind. As a blind person, are you traveling with cane or dog?
Unfortunately, well, I know that's a whole thing. Right now I have a cane, and sometimes now where I am, my cane is sitting, I usually just leave it unfolded and sit it beside the dresser, and most people see it. But when we were in a very small room and it was tight quarters, the best thing for me to do once I got there was to fold it up. And also, I can't assume with everything that they have to attend to visually that they will see my cane. It makes it nice, it makes it convenient, but I can't also tell you how many people have seen, because my 3 guide dogs have been black labs, have seen them curled up in a little ball on the floor, and then when the dog stretches, they kind of shriek and they say, "I thought that was luggage,"
Yeah.
So, yeah, that does help, but it's not, not always a given.
By the way, since this is the hospital you're talking about, what kind of hospital is this that you have to take the food and at the meantime there is no nurse to attend your friend, obviously suffering from stroke? Because most hospitals that I know in Boston, usually nurse obviously comes and helps them and tells them all of that. What kind of hospital you been?
Okay, first of all, it's she was in a regular hospital and then a rehab facility, short term. Now she's in a nursing home, and I do not have to bring her meals. But, like, you know, a lot of what they get is mass-produced. Today I got some strawberries at the store and cleaned them and cut the tops off and took her some fresh strawberries. You know, or I will take her the kind of pizza that she likes sometimes. You know, treats, basically. Treats, not, I'm not providing her full meal. And also, when I talk about a nurse, what I mean is it's my responsibility to learn my way to the bathroom. It's not the nurse's responsibility to walk me to the bathroom or walk me to get something to eat. I feel like I either need to know those things or I need to opt to do, well, especially the food, you know, to opt to do without that because they really are stretched. They're short for time, and I don't want that time to be taken away from a patient. I want to be an asset to them and not a liability or a problem. And maybe that's just my own personal baggage. Maybe I'm just stubborn that way, but I've seen too many blind people really take advantage and just expect to be coddled, and I don't really feel that that's terribly a good thing.
No, I agree with you, but the thing is, if you go there every day, you know, when the first time you may ask where things are, but then obviously you're going to know from after that, so you're familiar yourself. But anytime most people go to anywhere, even the sighted person, they usually ask, for example, you know, where is the, you know, bathroom, whatever. And
Correct.
But as a blind person, you know, they may just show you. And but that you know, obviously you're going to. So that's good. Nobody should expect, especially in the hospital, that nurse is going to take them back and forth, especially as a visitor that you go there every day. So I get your point. That's very good.
Right. And there's a difference between long-term and short-term. I mean, for example, when she was in the hospital, she was there, I think, 4 or 5 days. And it was long, winding halls. And so I had someone walk me to and from the room each time. Now, this was somebody who brought me. You know, this was my transportation. With the nursing home, the person, I'm living with some friends, and I pay them to provide my transportation. And basically what we do is they walk me in because when I get there, people are coming down to dinner. And there are a lot of crutches, walkers, wheelchairs, and I'm a little afraid of, I don't want to send someone flying, you know, like get my cane caught in something.
Sure.
And then when I'm ready to leave, which now tonight it was early, but normally it's around 8 o'clock, I walk down myself because with the exception of the occasional person or two, it's pretty well deserted. So, you know, and this is unique to my situation. Most people aren't even talking long-term stays. And, you know, really, like, everybody has different levels of comfort and independence. Some people might look at me and say, oh, well, even if it was only for 5 days, you shouldn't have had somebody walk you to and from. Big deal. You know, I had too much else going on. It just was not a priority to me for those 5 days that I learned the route. And everybody's different. So, you know, short-term, long-term, your own level of fatigue, your own level of patience is going to make a big difference.
Sure. Thank you.
Anyone else?
Yes, this is Karen, and I'm curious to know, I've been in rehab myself after I fractured my ankle, and my husband was in a nursing home, and my late husband, and hospital, so I know what you're dealing with somewhat in being a caregiver and all, being a advocate, and how fast you have to learn. But what I wanted to know, is she getting any sort of physical therapy during the day for her, you know, even though she has a stroke? Is she getting some? Because she should. What?
Yeah, she got about 20 days, and then the bean counters from on high, my skepticism is showing, decided that she was not progressing quickly enough, and they discontinued her therapy.
What a shame, because that would help her immensely in being able to move again and being able to do things again, because they should never cut that sort of thing off.
Oh, I know they shouldn't, and I've fought for it incredibly, because But basically, right now it's taking 3 people to assist her in any kind of transfer, and they're just basically telling me it is not worth it. So what I'm doing when I go every day is I passively exercise. I move her affected arm and leg through a series of range of motion exercises, which I was shown. And I also put lotion on her hands, her arms, her heels, her feet to keep circulation up. So, I'm trying to do what I can. And they do a little bit of, they call it restorative therapy, just to keep things, I think, from getting worse.
Because 20 days isn't going to do anything for someone with a stroke. They need long term. I saw someone in the nursing home I was in. She got, I don't know how many days, I think she was in rehab, but I think she went to long-term care. But she got physical therapy every single day, and I know it was over 20 days. She also got, she had trouble swallowing, and she had a pathologist helping her and everything. It was very good,
Yeah, they have made good progress there. She's gone from, the thing that surprised me was that they, after a stroke, a person needs thickened liquids. Like she was drinking things the consistency of nectar. And then honey, let me tell you, there was a grand celebration the first day. She could have, honest to God, unthickened Coke. She was so happy. So, we take those triumphs and we keep trying to work for what we can.
Yeah. And I would try to advocate for her to have more physical therapy. And I imagine you've been doing that.
Yeah, they're getting a little sick of me, and I don't really care because, I want her to have everything that she can. So.
Oh, yeah.
Any other questions?
Any other questions?
Well, if my computer will come back to me here any moment now.
I think that's Cleora. Go ahead, Cleora.
You mentioned contact, an email, a website, but you didn't give us the website. And also I wanted the phone number to call.
Okay. I'm not sure I can get the phone number because I'm on the same phone that has it. May, I don't know if you're calling in on a landline or not. Are you able to get that phone number for the PCB office and share it? If not, no problem, but the PCB website is PCB,
Lisa,
like Pennsylvania Council of the Blind.
I will get the
Wonderful
phone number in just a moment.
Thank you. I should have thought to do that ahead. So it's PCB, like Pennsylvania Council of the Blind. And then the number 1, PCB1.org.
Oh, that's pretty easy.
Yeah.
Pennsylvania Commission,
So it's PCB at PCB1.org.
No, let me give the website again from the ground up because I stopped myself.
Oh, okay. I thought it sounded like an email address. Okay, website.
No, I'm so sorry. The website for the Pennsylvania Council of the Blind is www.p as in Pennsylvania, C as in council, B as in blind, the number 1.org. So www.pcb1.org.
I have the phone number.
www.pcb1.org.
Correct. And I think May's got the phone number for us.
Yes, I do. It is 717-920-9999.
Okay, could you?
Yeah. 717-920-9999. Okay.
Thank you, Mary.
Okay, could you go? So I'm just going to put another piece of paper in and get this phone number here.
I'm thinking that 20 days, if they suddenly decided the therapy wasn't happening, may be a magic number. I think Medicare only pays for 20 days, and it's amazing how many people become either.
That's a stroke. That's nothing. Phone.
because I know when my brother was in there, I think it's called, or
What is the phone number for the Pennsylvania Council for the Blind again?
717
717
920 9999.
Okay, thank you very much.
yeah.
Any other questions for Lisa?
Okay.
We have Lauren on the line. Any questions from you, Lauren, or Eve, or anybody?
I'm unmuted now. No, I don't have any questions. I just thought it was very interesting, and I thought you gave a lot of good information.
Yeah.
Now, as
I just think more people should be doing this all over the country. I mean, it's great. I think it's wonderful to advocate for each other and to be, like you said, kind of common sense. But it's like, to me, it's wonderful, but it's like, we should have had this years ago. You know, you see someone in Pennsylvania doing it, that's great. But there's got to be more, we just got to get the word out, because this is really important, because it's people, our loved ones, our friends, our families, and
well, that leads me to a question, Lisa, of my own. Where you are a member of the Pennsylvania Council of the Blind, how much influence do you have to make sure that this goes national with the American Council of the Blind, and then move forward from there?
Well, our president has been working with that, on the national level. I have kind of taken things on a personal level. I've kind of taken them in a different direction by disseminating some of the information through Blind Alive, because there is that intersection, with health and wellness and such. And so I'm letting those who have that added influence in the national sphere do that. And really, right now, I have my hands quite full, as you can imagine, because I counted up the other day and this is not a toot my own horn, because I'm, no one's making me. I'm exactly where I want to be, doing exactly what I want to do. But I figured out the other day that between visiting and transportation and such, I'm there roughly 38 hours a week. So that's like another full-time job on top of a full-time job.
Sure.
So, I really had to kind of prioritize things. And so that's kind of where I am.
Sure.
Well, I have a caregiver that comes on Friday, and she's a retired nurse, sort of she retired on disability, more or less. And I said something to her, based on the person who spoke last week about, nurses not receiving any actual training. And she said in all of the time that she was a nurse, she doesn't remember ever having a blind patient. And I think maybe up until recently, now that the baby boomers are getting older, and many of them have macula and RP and various conditions, I think that's going to change. So now is the time to get that word out.
And also, a lot of people say, I've never had a blind patient. I heard two nurses discussing this, and someone said, we've never had a blind patient. And somebody said, yes, we did. Remember so-and-so? And she said, well, I knew he couldn't see that well. I just didn't know he was blind. And so that's why we put in there about total blindness, because a lot of people think that blind means total blindness.
Mm-hmm. Well, my brother was in the hospital off and on just almost constantly for about 5 years. And they had a sign above his bed, patient is blind. And I'm sure you would believe how many nurses never noticed that, had no clue he was blind. And he was totally blind. They would bring his food in and not tell him,
beware the meatloaf, especially when it sits and has a chance to ferment.
He didn't have experience, I don't think. But what if eaten that? What if you had discovered it? You can't smell and eaten it. You would have been.
Oh, yeah. Although the weird thing was, I I wasn't supposed to be getting out of bed without assistance. It was like the day after surgery. And the tray was all the way across on the windowsill, so that would not have happened. That would not have happened, but still. I mean, I go in sometimes and my friend will say, can you get my tray table? And they've got it like so far away from her, there's no way she could reach it. And I just think sometimes, you know, people...
Yeah, I got a story, though, that's kind of interesting.
Matter of stupidity. You know? Really.
Yeah.
That's
I know.
Yeah.
All of this, in fact, all of the things that you mentioned there, it's not a matter of training. Now, maybe that's the way we have to treat it, but it's not training.
But,
no.
you know,
I really think, I get skeptical after a while, in all honesty, about training, because I really think that a lot of it is common sense. Some people have it, some don't. It can be learned, but the people who really are the best at it are the ones that just have it intuitively, I think.
Yeah. But it's funny, when I was at Mass Pioneer, I had eye surgery, and they said I was going to be blind, so they had this is Mass Pioneer. They had a tag on my wrist that was saying this patient is blind. And most of the nurses didn't even, like you said, they didn't, it's like not seeing your cane. So they were just treating me like but nowadays I would be like, hey, where's my food, or where's the bathroom, or, that was just a long time ago. But it amazes me that I think education, they might give them a brief, okay, you're going to have a blind patient, and they're going to have this wrist tag, but are they going to remember that? So we just have to be patient, and it's frustrating, and just say, hey, this is what I need. This is what it's all about.
I think another thing may be in the selection of the type of people who become nurses. As you mentioned, intuitive. I have a caregiver that walking in the door, he understood these things. I didn't have to tell him. Others, I can tell them 1,000 times and they still don't get it. And I think a lot of it has to do with the type of people that are allowed to go into nursing. I think we need to think about, what kind of people those should be, not just anybody that passed the exam and walked in off the street looking for a job, but, a test to show that they have certain characteristics that lend them to being good caregivers.
Lisa, obviously you are a good advocate. That's great. And your story about the meatloaf, and I'll tell you, I can't help it to tell you, it's a good thing you didn't eat that meatloaf, because the meatloaf smelled that bad in 3 hours.
Yeah.
If you would have eaten that meatloaf, you would be alive today. So it's a good thing coming out of the factory eating stuff. That's awful. So I'm glad you didn't eat it.
Thank you. It's really funny, though, about the advocacy thing.
A couple days or something, and they just didn't take it away.
Yeah. I don't know. But I don't really think of myself as, like, a rabid advocate. This is sort of true confession time. I like when everybody's happy and everybody's getting along. I don't like to make waves. I don't like people to be upset. I don't like to rattle cages. But I was joking
Excuse me,
with
Lisa.
someone. I said,
Whoever's brailing, please mute your phone. Thank you.
Oh, 1 second.
But I said, after my friend had this stroke, I've kind of gotten in touch with my inner mama bear, and I will advocate for her for things I might not for myself. And so, that's probably not the best way to be, but sometimes it's like, well, whatever it takes.
Well, sometimes you have to be. You have to make noise to be heard.
Yeah, and, I figure right. some noise that, on behalf of my friend is better than no noise. And I think that advocacy is a habit. It's a muscle that we can exercise, and it will get stronger. And, we do learn with exercise how to advocate more effectively. And, wow, we're having amazing thunder here. I don't know how much of that you can hear, but it's...
It's about making waves. Yeah.
Yeah.
We can make ripples and not waves.
Yeah.
Yeah, I like to say we're making ripples, and I understand we all want to be happy, and we don't want to cause a fuss, but sometimes, you got to drop a pebble in there and say, hey, look, something's going on over there.
You have to.
Yeah.
Yeah. Yep.
Yeah, I thought of something.
And we have time for a couple more questions.
Oh, you mentioned a while back that I think maybe the hospital or something has to provide so much training. What is it, every month or however often? And
I don't know the specifics. I just know that they do.
I just wondered, is that every hospital or just, that particular one or a few?
I really don't know. I know that some professionals, whether they be nurses, social workers, whatever, need to receive continuing education, and this can qualify. That's kind of my knowledge there is very broad, very generalized, very kind of sketchy. So I would not take that as gospel for your area. Very little of this I would take as gospel for your area. I'm just kind of sharing this document with you and also sharing some of my personal experiences in the hope that it's helpful.
Well, I know that some professions, anything that has a license, I'm not sure if this is true for everything, but like CPAs, anybody that has a license has to attend a certain number of hours of continuing education to keep that license current.
Yes. Mm-hmm.
Maybe this applies, in that case.
I think it does. I think in general terms, it certainly does.
That would be a foot in, you might say, to get information out.
Yeah.
Yeah.
Okay, one or two more?
I have a question, another question about your friend there who's a patient. Now, do they have any activity directors there that can help her get involved when she's able to in any activities, or have they done a
Yeah, they have. She's done some of it, and she's a little hesitant to go, and so sometimes I'm able to arrange my schedule so that I can go to activities that I know will be of particular interest to her. But yeah, she has gone to some, and they do have. One thing I am working with them on is there's a lot of print information. There is a printed activity schedule, and there is a printed menu for the week. And the reason that that's important is it has what's on the menu, but it also has alternate choices.
Right.
And right now I'm getting someone to read me the menu, but neither one of those things scans well. And you can't tell me that that's not being typed up on a computer somewhere. And so I'm trying to get those emailed to me. So far I have struck out, but I am continuing because
I would think that might be part of the job of somebody there to read her the menu for each day. Because when I was in the nursing home, they did that.
It is, but I need it. They give it out for the week, and basically I need it read for me because she has some short-term memory loss, and she will forget to contact them. So like this morning, I had the menu read to me for the week yesterday. A friend who was visiting came in and read it. And so I knew this morning that she wanted the alternate for lunch. So I called the nurse's station and asked them to request it. And she might not remember, on Tuesdays and Thursdays I wanted this. And she can read, but this is in a chart form. And the way that the stroke affected her vision, she can't make sense of the chart. So I really need to have it kind of interpret it for her.
It would be something that they ought to make available to her, either by a nurse reading it to her or to make it in a form that she can simulate.
Yeah. There's a lot of things they ought to do, but
they don't.
They don't do it for anyone else. I don't see it happening. I think the easier solution, at least for the present, is for them to get me the documents in accessible format.
Well, it's just so wonderful that she has you.
Yeah, absolutely.
Has someone there,
I feel very lucky to have her. I feel very fortunate that she survived the stroke.
Oh, yes.
Well, this is just one case of many thousands or millions maybe that are going on every day because of people who are in the hospital or a nursing home or whatever, and they don't have someone who comes in and checks on them on a regular basis. especially in a nursing home, if there's not somebody that comes by every day to check on the care for that person's care pretty much.
Count on it. Yeah. That's why I'm dogged about getting in there every day. And that's why I sometimes switch it up and come in the morning when they expect me in the afternoon. I want to know what's going on.
Mm-hmm.
Yeah. And this is supposed to be one of the better rated ones, and I still find a lot of things lacking. I mean, I've already had 2 chats with the director of nursing because I was really unhappy with some things, how they were handled. She was left to wait for like 3 hours one day when she needed to be transferred into bed and was having significant pain. So, on and on it goes.
Yep.
Mm-hmm. Well, and some of it I think you mentioned early, a lot of these places are really don't have enough staff. They're really short-staffed.
No, they don't. Yep. They don't. I mean, they're passing in the halls, and I feel like, they should have skates because they're running.
Mm-hmm. And so anything that isn't an emergency kind of falls by the way.
It's all about triage.
Yeah.
Yep.
Yeah. Put in the waiting room, right?
Yep.
My father always used to say that. Yeah.
So the moral of the story is don't get sick.
There you go.
That.
Yeah. And if you do, be your own advocate or hope you have someone as an advocate.
Yeah, that's it. You got to hope you have someone if you're that sick.
And really, when you're that sick, you do need someone to advocate for you, I think.
If you
well,
can,
and a lot of times people are so busy, there's no one really available to be an advocate. So we can always do wonderful things.
Yes, you are, Lisa. You're really doing wonderful things and keep up the good work. And, fortunately, I have not had a hospital stay myself. I've been an outpatient once or twice in my life, but never had I stayed. And hopefully, if, God forbid, I have to, that I get the proper treatment and advocacy that you're talking about this evening.
For sure. And that's why laying the groundwork and circulating documents like this ahead of time is so important. You're laying the foundation for someone else, and you could very well be laying the foundation for your own care as well.
Mm-hmm.
Yeah.
Indeed. Well, thank you, Lisa Salenger, for being with us this evening, and keep up the good work.
Absolutely.
My pleasure.
Indeed.
Nice having you.
Everyone have a good evening.
Yes.